Hello, my name is Grayson Van Haltren, and today we will be going over vector-borne pathogens, ticks. First of all, what is a vector-borne pathogen? Well, in simple terms, it is when insects pass disease onto their hosts, hosts being the animal or plant they are currently feeding off of. Now, when you first hear this, you usually think of mosquitoes, and you wouldn't be wrong, but many forget to be mindful of ticks. I picked to do my presentation on this subject because a family member very close to my heart has a major bug phobia. The entire summer they were extremely terrified at the idea of a tick getting onto one of my dogs, myself, or my little brother. After every single walk, I and my brother would have to do tick checks on not only the dogs, but each other. Not only that, but we were also not allowed in tall grass and always had to have our skin covered, no matter how hot it was. This annoyed me greatly, so when the opportunity came up to really get the chance to understand why my family member was so concerned, I leaped at the opportunity. It surprised me to find that their fears were in fact very, very valid. To start off in this guide, we will start with what are ticks, how ticks transfer disease, the symptoms to identify, how to test for disease caused by ticks, and how to treat the disease. Now for an understanding of ticks. Although ticks are commonly thought of as insects, they are actually arachnid like scorpions, spiders, and mites. All members of this group have 4 pairs of legs as adults and no antennae. Ticks are among the most efficient carriers of disease because they attach firmly when sucking blood, feeding slowly, and may go unnoticed for considerable amounts of time while feeding. Unlike most other insect bites, the tick's bite is painless and non-irritating because its saliva contains an anesthetic to numb and reduce pain, an antihistamine to reduce allergic reaction or itching, and finally an anti-inflammatory to reduce swelling. Now, why are ticks such a problem? Well, the thing is, ticks are zoonotic, which means that they can transfer disease not only to your patients, but also to yourself. Scary, isn't it? Now, there are literally hundreds of species of ticks. But the one that we mostly worry about in a clinical sense is the black-legged tick, also known as the deer tick. Black-legged ticks can be found in many areas of Canada. Even where tick populations have not been identified, there are often ticks. These ticks are introduced into these areas by migrating birds. About 10% of these ticks are infected with the most common disease found in ticks called Lyme disease bacterium. Now, it is important to remember that although black-legged ticks are most famous for the transport of Lyme disease, this is not the only disease that they can pass on. Please turn to page 1 and 2 of the pamphlet to be able to see a complete list of the diseases that can be caused by ticks, along with their symptoms. The most important one to see would be Lyme disease. I will give you a couple seconds to be able to look this over. This would be a good time to pause the video. Now, you may have noticed all these diseases have a symptom in common. It's fever. If fever is seen in a dog, there is a chance that it is a symptom of a disease caused by a tick. The tricky part about this is that dogs often do not show symptoms for weeks or even months after the infected tick bite. But if the dog is showing these symptoms, it most likely has Lyme disease out of the possible diseases that can be transferred. So how do you test for Lyme disease? There's a test called the SNAP 3DX/4DX test. It's a great test because it only requires a small amount of blood from the patient and can be done fairly quickly. Most veterinarians send out a sample to labs to be performed, but you may be expected to be able to do this in clinical. Please turn to page 3 of the booklet where you can find step-by-step instructions on how to perform this test. So let's say the dog's results come back positive. To treat the dog, the American College of Veterinary Internal Medicine recommends a 30-day treatment with discosyline. You should test the dog's blood level and kidney functions throughout this period. If the dog's kidney function tests were abnormal, the dog may need to be put onto medication longer or receive a diet formulated to minimize kidney problems. If the dog is experiencing joint pain, an anti-inflammatory may be prescribed. So now you know about ticks, how ticks transfer disease, the symptoms to identify, how to test, and finally how to treat. I know it's a lot of information, but you're doing great. But we still need to cover how to prevent, how to educate your clients, how to remove a tick, what are the safety protocols for handling a tick, and finally, how to store a tick. Let's start with how to prevent Lyme disease. There are 3 very simple ways: vaccination, protection, and education. In clinic, vaccines can be administered and annual Lyme disease checks can be performed. You can also, for additional protection, sell one of the many varieties of anti-tick sprays, shampoos, tablets, and even collars. Finally, just as important is educating the public. It can be very simple, from doing tick checks, avoiding tall grass, and having your legs covered. Find out how high the dog's risk level is. Is it a Springer Spaniel who's always in the bush hunting with its owner? Or is it a bulldog who barely leaves the couch? You and your client should be also aware of your area and the level of risk that is associated. Turn to page 4 of the booklet to find a map of Canada. The arrow points to our area. As you can see, we are in the orange section, which means that pets and also people of this area are at risk. You should also know and then teach your clients how to remove a tick. It is important to know how to do it properly because when ticks are frightened, they secrete more cementing, which makes chance of infection of disease higher and the tick more difficult to remove. This is what you should do. Let's say an owner comes in and they have a Shih Tzu, and their Shih Tzu has a tick still attached to the skin biting down, and the owner asks you to remove it. This is what you should do. First of all, get your gear. You should get a pair of gloves, clean pair of tweezers, or a commercial tick remover will also do, antiseptic, and finally isopropyl alcohol. Then you should put on the gloves. Next, while wearing the gloves, remove the tick. Remember to avoid contact of the tick with your skin. If you're using tweezers, you should first grasp the tick as close to the dog's skin as possible, but remember to be gentle and try not to pinch the dog's skin. Then pull upward in a straight, steady motion, making sure that you remove the entire tick, since anything left behind could lead to an infection. If you're using a tick remover, first, gently press the remover against your dog's skin near the tick. Slide the notch of the remover under the tick. Continue sliding the remover until the tick is caught at the small end of the notch and pull free. The tick will remain in the bowl of the remover. Now it's important to remember that when you're removing a tick, you do not grab at the body. The body is the biggest part of the tick, yes, and it may look like it's the easiest part to grab, but in fact, you are putting the dog more at danger. Because when you start pulling at that body, the tick gets scared, and as I said before, it'll start cementing and bite down harder, making it not only hard to remove, but the transfer of disease risk will become higher. Many people will go to just grab the body, but you must grab at the head. Now, if there's any confusion with this, please look at the video provided in the video link below. It's a great video that goes step by step how to be able to remove a tick, in case you're a visual learner, which is what I am also. Now, just got to really put this in here. Remember to get your gear before handling the tick. You do not want to have tick-to-skin contact, because if the tick bites you, that means that you can get infected too. Another thing to remember is that when you remove the tick and it's completely removed, do not dispose of the tick by putting it into the garbage or by placing it onto the countertop. You are then having the risk of infection for the countertop and also for the garbage. Plus, if it turns out that the patient was positive with a tick-related disease, you may want to have to get the tick checked to be able to see what disease was inside that tick. And if you've thrown at that tick, then you can't do that. So what you should do after you remove the tick is, with the tweezers and wearing gloves, put it into a Ziploc bag. Completely seal the Ziploc bag, and sometimes if you want to make sure it's completely sealed, get some tape and tape around the seal. Then you want to get a marker and mark the exact date and the patient's name of who you got the tick off of. Then store the tick in either a file folder or another safe area. Remember to tell your other their coworkers that you have done this and where the tick is being stored. Because ticks are so small, your coworker may pick up the bag, think it's an empty bag, and throw it out, thus making the garbage area possibly contained and contaminated, and also making it so that that tick cannot be tested. Thank you for listening. I hope that I was able to help you increase your understanding of ticks. Remember to keep yourself and your patients safe from these nasty little arachnids. Now, want to test yourself? Here's a quiz. I made a little quiz with all the information and answers can be found in either the booklet or the PowerPoint slide. It's a good way to be able to test and make sure that you 100% understand how to work with ticks and the safety requirements that go along with it. If a password is required, the password is Daisy. To find my references, please turn to page 4 of the booklet. For a typed version of the audio recordings, please turn to page 5 to 10 of the booklet. I hope you have a wonderful weekend.